Good afternoon. This is Steve Ortega, Policy Fellow at the El Paso Chamber. And today it's our pleasure to have with us State Representative Cesar Blanco. We're going to be talking to Representative Blanco today over the COVID crisis, the state's response, hopefully get to a couple of questions that some of you may have, and then hear a little bit about him, his background, and then some of his future plans as his political future is unveiled. Cesar, can you hear me?
I can hear you just great. Great to be with
Wonderful.
you, Steve.
Thank you so much. Before we get started with the hardball questions, can you give our viewers a little bit of background about you, where you're from, where you went to school, and then how you got involved in elected office?
Yeah, absolutely. Thank you. And thank you, Steve, and the team at the Chamber. You all have done a phenomenal job. So it's an honor to be here with the members on such a tough situation in this pandemic. Well, I'm from El Paso. I grew up in this community. I went to Bonham Elementary, MacArthur Middle School, graduated from Eastwood High School. I'm a graduate of UTEP, served in the military, active duty for about 6.5 years. And after that, worked for a variety of members of Congress from being a caseworker all the way up to chief of staff. So I've got a lot of federal policy experience. Decided to use my skill set, run for office here at home. And I've been a state rep here in El Paso now for getting close to 6 years now. As you all know, Senator Rodriguez announced his retirement. And since then, I have jumped into the race for the state Senate and made it out of the primary okay. And now into the general election. So hopefully that turns out well, but a lot of important work for our community in West Texas. We've got a great deal of need. We all know that El Paso hasn't always gotten its fair share of resources. We're talking about infrastructure, we're talking about education dollars, we're talking about access to healthcare, those type of things that elected officials, along with our business community and our business leaders, should be working together on the same page, and we're doing that. And I'm excited to be part of that, and it's great to be here to talk a little bit about what's going on here, what our outlook is for the future of El Paso as a result of this pandemic, and to have a real good conversation.
Wonderful, wonderful. Let's just jump right into the fray. Give me a summary from your perspective of Governor Abbott's response to COVID. I know different governors from different states are taking different strategies on how their state is going to respond to COVID. Some are being very aggressive in opening up for business, states like Georgia, Florida. Then you have some other states that are trying to balance the public health with the need for continued economic development. From your perspective, where is Texas and what has our governor's response been?
Well, as you all know, there have been a variety of responses throughout the country from different governors. Here in Texas, one of the things that we've really been focusing on is trying to get people tested. We've had about 455,000 people in Texas that have been tested. 35,000 people have tested positive for COVID-19. And unfortunately, we've had about 973 deaths as a result of COVID. Here in El Paso, we have 1,190 positive cases and unfortunately 30 deaths in El Paso County. And 7 of those deaths, as you all have been paying attention to the news, occurred yesterday. So we're seeing a spike here in our community. We had 71 new cases reported yesterday. 62 of those folks are in hospitals. And then of those 62, 40 are in ICU, the intensive care unit. So we're concerned overall at the state's posture. We want to make sure that that folks are compliant with the orders. Now, for a long time, we saw folks staying home because of a statewide, essentially a stay-at-home order statewide. But as a result, recently we've seen a spike, particularly here in El Paso and West Texas, and local officials, the Mayor DiMargo and County Judge Ricardo Samaniego, and the Public Health Authority are concerned that that was because of what we're seeing now is because of Easter. People were getting together. People who were not living in the same household with others were probably getting together and getting more exposed. So there's a concern that the reopening could lead to that eventually. Couple of important things that are happening here on the ground that I think that are important to note. El Paso, the city, the county, as well as in cooperation with the Medical Center of Americas, have been putting together a plan that includes business community, healthcare leaders. We're going to receive some Battelle decontamination units that the state of Texas secured. And these are for the N95 masks. Basically what it is it allows these masks in these units, which will be a total of 6 units in the state of Texas. These units are going to be used for decontamination. These things are the size of a single family home. They're about 6,000 square feet. They can handle large volumes of PPE that can be decontaminated. I know Houston, San Antonio, Dallas is getting one, but we're going to get one here in El Paso as well. And it allows hospitals and providers to have those PPEs, those masks available for decontamination. And a single mask can provide a lot of protection for our folks, not only for healthcare physicians and patients. The governor also announced that there's going to be facility decontamination teams put out there in order to assist nursing home and long-term care facilities. We've heard a lot of concern about our family members that are living in some of these nursing homes. So they're put together in order to assist these nursing homes and facilities to protect some of those vulnerable residents from the spread of COVID. The state is instituting facility decontamination teams also that are providing comprehensive deep cleaning for these facilities. To complement that, there's an educational effort. I read the Texas Department of Emergency Management situation reports daily, and also the El Paso Emergency Operation, the EOC reports daily, and you can see how much education these teams are doing out there. So overall, Texas has done a good job in terms of trying to flatten the curve. What concerns me now is where we are in the stages of reopening. My concern are a couple of things. Do we have enough testing? Do we have enough, folks, ICU beds? Do we have the hospital capacity? These are all things that we need to take a look at before we fully open, and making sure that our community is safe.
Okay. And you talked at the beginning of your intro about wanting to advocate for El Paso to get the resources from Austin that are needed for our community. Oftentimes, we're an afterthought after cities like Dallas, Austin, Houston, San Antonio along the I-35 corridor and east. When it comes to resources for testing, how has El Paso fared when compared to the rest of the state?
Well, we can always do more testing, and we need to definitely do more testing before we fully open. That's my perspective. The more we get a sense of how many folks are testing positive in our community, the better we can address this issue, the better we can handle the response when patients are coming into the hospital. The other part of this is the contact tracing. We definitely have to expand contact tracing. It's a core public health practice. We've seen this done in a variety of pandemics in other countries, and so it helps public health workers identify and follow up with people who may have been in close contact with someone with an infectious disease. Once that person is identified, a contact is informed about the possible exposure and assessed for symptoms, given instructions and resources for isolating themselves, and connected to testing when needed, right? So I think to support the efforts to reopen, the Department of State Health Services is working to expand contact tracing and testing capacity in the state of Texas, and we need more in El Paso. I think yesterday was a perfect example of why we need more. And up to this point in the COVID pandemic, there have been about 800 public health professionals in Texas engaged in contact tracing. We need more, including both local health departments and DSHS staff. The city of El Paso started doing contact tracing on April 30th, but the reality is we really still need more testing and more contact tracing. Without an accurate count of cases, we're really operating in the dark as to whether or not we can be ready to reopen the state of Texas and El Paso.
And Representative Blanco, I'd like to get your thoughts following those statements that you just made. County Judge Samaniego has stated that if the numbers don't go down here in our community, he may ask the governor for an exemption from some of the governor's orders. The idea being El Paso is a little bit different from the rest of the state of Texas, our location, us being a binational community, us being a community that's 85% plus Hispanic, where a lot of the members of the community may have underlying issues like diabetes, blood pressure, et cetera. What are your thoughts on a potential carve out for El Paso from the governor's orders?
Well, I think that you got to take a case-by-case approach. I do agree with the County Judge Ricardo Samaniego and the request that you look at if there's a flare-up in a location that we have the ability to deal with that. Let me take a step back first to talk a little bit about the governor's faith and approach to reopening the state of Texas and how that relates to where we are and where we're going to be soon, and how that impacts our ability to flatten the curve. On April 27th, the governor authorized the reopening of dine-in restaurants, movie theaters, retail stores, shopping malls, as long as they opened at a 25% of their capacity. And that doesn't include employees. That only includes those that are going in there to receive those services. The order did not require businesses to open. It just authorized them to do so, which I think is an important distinction. This was the first phase of his plan to reopen the state of Texas, which was supposed to last 2 weeks. The idea was that during those 2 weeks, the state would monitor the situation and then make a determination to move forward with reopening other industries if it seemed safe to do so. However, 5 days after his issued order, we have seen the reopening of beauty salons today, tanning salons, swimming pools, and by May 8th, it's going to be, I'm sorry, 18th is when they're looking to do another phase of the reopening. From my perspective, I think we're kind of getting early without any helpful data. So I'm a little concerned about how fast we may be reopening. There's got to be a balance to that. And I think when Judge Samaniego and Mayor Margo are looking at flare-ups, as we saw yesterday, that they're given that flexibility to be able to make those decisions on the ground to keep our community safe. Steve, you're right. You brought up the issue about Juarez next door. And Mayor Cavada just recently announced that he had tested positive for COVID. This is a very real thing. People are dying, and it's sad. We've got to do everything in our capacity to make sure that we're keeping people safe. So it's my hope that the governor provides that type of flexibility, and it sounds like he is, based on this last press conference, that when there's flare-ups, he'll be sending in strike teams and working with local communities to figure out that flexibility to address the spread of COVID in their own communities.
Okay. Let's talk a little bit about the next legislative session, which will begin next year, and how COVID affects the prospects for that session. I know the state revenues, the chamber does a lot of work in transportation, and state revenues as it relates to the gasoline tax, as it relates to auto sales, as it relates to vehicle registration. All those revenues are going way down, affecting traditional forms of funding for transportation in our state. But beyond transportation, what are the prospects for the next legislative session, and how is COVID affecting how the state is going to do business?
Well, when you look at what the legislature does, I think the most important thing that we do is pass a budget. And quite frankly, it looks like we're going to be going into a very, very tough budget year. There are a lot of unknowns right now at this point, but first we have to check what the revenue estimate is, and the comptroller is the one that puts out the revenue estimate, and that comes out before every legislative session. This estimate, the statement that the comptroller puts out, shows the state's financial condition, and it estimates the revenue it can expect to receive during the next 2-year budget cycle. This biennial review estimate, it's also known as the BRE, it really forms the basis of the state budget for the coming biennium. And legislatures must ensure that the total appropriations do not exceed the available cash and anticipated revenue as projected by the comptroller. The comptroller has been advising state agencies to cut their spending ahead of update projections. We've heard this also from other leaders in the state. We need to take a look at the projected tax revenues that's going to be expected to be released this summer. The comptroller believes that this tax revenue projection is probably going to be revised downward, an adjustment of several $1 billion. And we're going to take a hit on sales tax because people haven't been out purchasing things. Now, before the pandemic hit, Russia and Saudi Arabia had a price war that impacted our oil and gas tax. As you all know, our budget relies on oil and tax gas. And now that we have an additional impact of COVID, separate from the Russia-Saudi price war on oil and gas, we're going to have to deal with COVID as well. So we were already going to have an impact on our budget based on the limited oil and gas tax, but now because of COVID, and now that the Saudi and Russian price war has been settled or in the positive direction, we're still dealing with people not driving anymore and not increasing the revenue. In the last biennial revenue estimate, the state comptroller said that 54.5% of the state's general revenue during the current 2-year period would come from sales tax. So oil production taxes would account for 6%, and natural gas production taxes would bring another 2%. And then those severance taxes were expected to bring $2.8 billion this year, and next into each of the two big accounts, the State Highway Fund, the Economic Stabilization Fund, which is also known as the Rainy Day Fund, which is another pool of money that we could potentially tap into next session, and we may need to because you can only do that during an emergency, and this absolutely is an emergency. That fund was set up to manage as a management tool to smooth out volatile sources of revenue, such as oil and gas related tax collections. And currently there's about $8.5 billion in that ESF fund that we can tap into. So it's, in a nutshell, Steve, it's looking to be a tough budget year. One of the things that we really needed to look into funding was public education. We did a good job funding for this biennium, but we didn't go into the next biennium. So that's going to be a challenge that we're going to be looking at for next session. And on top of the other things, transportation, infrastructure projects, as you know, we need to resurface I-10 here, and that goes through El Paso. So there's going to be a lot of budget impacts, and hopefully we can get back to utilizing these funds that are available to us to deal with some of these budget gaps.
And just real briefly, as it relates to El Paso's priorities, I know that we received funding for the dental school, but we're expecting an additional injection next legislative session. Is that potentially in jeopardy? What are your thoughts on that?
I mean, the budget is, we're looking at all the funds that we have available to us. It's difficult to predict what a pandemic can do to our economy and our resources. When you look at a budget, it's really a moral document. It's where you're going to put those resources the state believes is the most important. There's always the debate about the $800 million in a biennium that's used for border security. That's a federal responsibility, right?
Right.
We need to look at those $800 million and say, federal government, that's your role. Can we use some of these resources to plug in a lot of these different gaps that we may have for transportation, for healthcare, for public education, for our dental school here in El Paso? So these are going to be tough decisions that we're going to be having next legislative session. It's not an easy thing, but know that your El Paso delegation is going to be advocating very hard for those dollars to getting our fair share. And look, we've got a great team. We've got an appropriator. We've got someone who serves on the LBB. We've got, which is Mary Gonzalez. Speaker Pro Tem Joe Moody is in a leadership position. Lino Ortega serves on transportation. Art Fierro, who serves on elections, which is going to be a big issue coming up here pretty soon, actually, whether or not we're going to have all mail ballots, vote by mail ballots pretty soon. So we've got a great team together, and we're going to be fighting for our fair share.
Very good. Just a couple of more questions as we wrap up. And this is an opinion question. I've talked to a lot of different people that I respect in terms of when does this wind up? When do things start to get back to normal? And I've heard everything from this summer to next fall. A good friend of ours who I respect a lot thinks that it's going to take everyone getting it before this thing goes away. And so, the opinions run the spectrum. What are your thoughts in terms of when do things start to get back to normal for us?
Well, I'm going to try to base my if I were in charge for the day, it's going to be based on data and science. If the faster we have more testing, the faster we have more people that are doing contact tracing, the more resources that we put into our healthcare facilities to protect our patients and our healthcare providers, the faster we're going to flatten this curve. And my fear is that if we do a full reopen and we get another wave that could be in the fall, that's also going to be dealing with a flu, that puts us in a very tough predicament. So I want to make sure that we're looking at the data, that the data and the science demonstrates that we're safe enough to get back to normal. And I think that's the most important thing that we should be focusing on. But, I'm an optimist. El Paso has had a tough year between the shooting, between the narrative of how people say that our border region is lawless and unsafe, and now COVID. We've had a very difficult year, but there is no doubt in my mind that our community is a resilient community, and the best of the world are from this community, and we've demonstrated that, and we're going to get through this just like we get through anything else.
And you said you're an optimist, and there's been a lot of gloomy talk over the last 25 minutes over COVID, and it's affected us all. But I want to end on a positive note and ask you a personal question. What positive or positives for you have come out of this crisis, trying to find the silver lining, like I said, in this crisis that we're all going through? Have you yourself found any positives that have come out of this?
I think I'm doing a lot more running.
Me too.
On a personal level, I've got my GPS watch that tracks how many miles I'm putting in. But honestly, Steve, after every major global event, whether it's war or a pandemic, human beings are resilient, and we learn from things, and we come out better and stronger. One of the things, just at the micro level, the pandemic has changed the way we do our work completely. And this is a perfect example of that, right? We're kind of having this town hall, and it's virtual, and we're talking to each other. But I have found that working from one location and utilizing our technology are making things far more efficient. I can knock out 5 to 6 meetings in the morning, because I don't have to drive from here to there. Things are efficient because people, you can contact them. So it's been interesting. The downside, something that really impacts our community, that we were doing a very good job, and we're still doing a good job. And I want everyone who's watching this, if you haven't filled out your census, do it, because it means money for our community. And El Paso Complete Committee, which is composed of business, government, nonprofits, a whole coalition of folks, have done a good job. And El Paso right now is ahead of the state in response rate.
Wonderful.
Yeah, but we still have a long way to go. And we need to use this pandemic, this time where we're in front of a computer at home, to fill out the census or fill out the mail out census product. That way we have a higher census count. More people means more federal dollars for our community, and guaranteed we're going to need it after this pandemic.
Awesome. Well, thank you so much, Representative Blanco. I know you do a great job for us in Austin. I'm proud to have you representing our community. We thank you for your public service. Thank your staff for helping to set this meeting up. Also want to thank from the chamber, Ms. Peña, Christina, for helping to set this up. She did an awesome job.
Yeah.
And stay safe. We look forward to seeing you soon. And again, thanks again for your time this afternoon and your service to our community.
Great to be with you, Steve. Thank you all.
All right. Thank you, my friend. Take care.